My name's Addie,
And my name's Paige
and today we'll be talking about LSD and its clinical use
for
for
PTSD.
LSD was first created in 1943 at Sandoz Pharmaceutical Laboratories in Switzerland by Albert Hofmann. By 1957, over 1,000 articles all on LSD had been published, and the term psychedelic was coined in 1957 as well. LSD is a synthetic chemical, which means it is created in a laboratory, and it is derived from ergot, which is a fungus that infects the rye plant.
The behavioral effects of LSD include impairment of executive functioning, cognitive flexibility, and working memory. However, it does not influence the quality of decision making or risk taking and improves visuospatial memory. The behavioral effects that LSD produces varies based on several things: your age, how sensitive you are to the drug, how much and how often it's taken, how long you've been using the drug, the route of administration, the environment you're in, any mental illnesses that you may have, and if there are other drugs or alcohol being mixed with LSD. Some mood effects include anxiety, fear, physical, visual, and auditory hallucinations, physical sensation, feeling of losing control, panic, suspiciousness, and helplessness.
Next, we'll be talking about the pharmacokinetics of LSD. LSD is absorbed in the gastrointestinal tract. The amount of food eaten before and the pH of the stomach and duodenum influence the absorption of LSD when taken orally. There is no information on if depot binding affects bioavailability. Half-lives vary by species. In human, it is 175 minutes and is metabolized by many different enzymes in the liver. LSD is metabolized mainly by 2-oxo-3-hydroxy LSD, but there are other metabolites that help along the way.
Mechanism of action for LSD is sort of unknown. LSD is a partial agonist of the D2 dopaminergic receptors, and there are other ways that the drug initiates its effect that are also unknown. Flashbacks or sudden recurrence of the user's experience can trigger traumatic or strange experiences even after many hours or months of abstaining from the drug. LSD mainly activates the 5-HT2A receptor, which is shown above, and like I said earlier, the mechanism of action is not well understood. It is thought to interact with the serotonin system by binding to and activating the 5-hydroxytryptamine subtype 2 receptor, which interferes with the inhibitory systems, resulting in perceptual disturbances.
Abuse potential of LSD. Tolerance generally lasts only a matter of days. Tolerance to LSD is generally psychological rather than being of physical tolerance. The tolerance, as mentioned, disappears after a few days of abstinence without producing any cravings. So LSD dependence is typically psychological, not physical. And LSD withdrawal is unpredictable, and the duration of that withdrawal varies person to person.
Now we're going to be talking about LSD and its use of treatment for PTSD. So first off, what is PTSD? PTSD is post-traumatic stress disorder, which is a complex mental disorder that affects around 7.7 million adults in the US every year. And according to the DSM-5, PTSD is characterized by recurring and distressing symptoms that last at least 1 month after the traumatic event. Some symptoms of PTSD include dissociative reactions, distressing dreams, avoidance of trauma-related stimuli, perpetual psychology, distress, adverse changes in cognition and mood, and variation in arousal and reactivity. So using LSD in clinical treatment for PTSD. So first off, LSD reduces the amygdala's responsiveness when processing emotions, which can help PTSD patients as they frequently experience increased amygdala activation. And LSD may play a major therapeutic role in the management of PTSD by virtue of other acute effects, which can be higher levels of emotional empathy, increased insightfulness, improvements in acceptance of the trauma that was experienced, and emotive transformal events. And lastly, LSD can be a mediator in the long-term recovery from PTSD. PTSD is typically a lifelong thing that people are recovering from, depending on the severity of the trauma experience. And the effects listed above are key players in the long-term recovery of psychological change and other mental health disorders as well. References!